Hello, today I'm going to talk about one of the most common diseases that we see in our digestive clinic, which is piles or hemorrhoids. So what is piles, or what is the causes of this problem? How can we treat it? What are the types? What are the complications? All of these will be demonstrated in this video, and I will use this anatomical model to help us to understand the anatomy and the causes of the piles. So this is considered as the anorectal area anatomically. Let me try to help you to understand this area. So here we have a muscle. This muscle is called levator ani muscle. It is the muscle that elevates the pelvis. This muscle will split this area into two areas. Above we have the rectum, which is the last part of the colon, and down we have the anal canal. So normally we have like vessels in this area. It is like an area of anastomosis. So we have a plexus in this area of the rectum. Usually should be not that much dilated like this. This is the normal shape of the rectal plexus. But when these vessels become engorged, when these vessels become congested, it could be enlarged, tortuous. In this case, we call it piles or hemorrhoids. When it is congested, it will be like this area. We can see this bluish area. This is the congested part of the piles. So this is what we call the piles. So it is a congested veins in the area between the rectum and the anus. And according to the anatomical location, we have two types of piles, either internal piles or hemorrhoids, or sometimes the piles can protrude out through the anal canal, that we call it external piles. Actually, both of them could be protrude, but it depends on the severity of the case. So why we have this engorgement, why we have this enlargement of these vessels? It could be related to many causes. For example, one of the most common causes is our prolonged sitting or standing for long hours. It can lead to let's say bad circulation of blood in this area, and this will lead to engorgement or congestion of the veins in this form. Other causes could be related to constipation. When we have severe constipation or prolonged or recurrent constipation, there will be pressure on these veins, and it will cause these piles. Sometimes it could be related to family history, so it could be familial. And as I said, the lifestyle is too much important in this case. Because of our sedentary life, there are now more cases of piles or hemorrhoids. What is the symptoms that we see in patients with piles or hemorrhoids? Usually, many of the patients could be associated with constipation, although also this problem could occur without constipation. And usually the patient could have no symptoms, asymptomatic, or sometimes they may have like fresh blood per rectum. So they see like fresh blood in the toilet, in their stool. Sometimes this blood could be mixed with the stool, or even sometimes like dripping of blood alone or without stools. Usually hemorrhoids causes what we call painless bleeding. Yeah? So usually it doesn't cause pain. In some cases, when we have complications like thrombosis or torsion of these piles, it may cause pain. And according to the degree of extension of these piles, we may have several degrees of severity according to the size and to the extension out of the anal canal. How can we treat piles, or how can we help the patient to have less episodes of blood per rectum. Number one, we should always encourage the patient to have a good activity. So sedentary life or prolonged sitting or even prolonged standing also can affect on this problem. So activity is very important, especially when we do activity or let's say exercise to the pelvic muscle. One of the most common exercises is Kegel exercise that can help to improve the circulation in this area. Number two, also we have to treat the constipation by giving a high fiber diet and low carb diet, and sometimes we have to give medicine or check what is the cause of constipation. Also, sometimes we can give like local treatment by warm water seeds, or we can give also local ointments or creams or suppositories, in addition to some tablets that can decrease the congestion of this area. This type of treatment, we call it conservative treatment. It means it just depends on lifestyle changing or some medicines, and it could be effective in about 85% of the cases. But actually in some cases we have to go more when we have recurrent episodes or the patient does not respond enough to conservative treatment. At that time we may need to do either band ligation of the hemorrhoids or laser coagulation, and in some cases we have to go into surgery when we have large hemorrhoids or they fail to be treated by simple procedures. So this could be like common, let's say, summary about the piles or hemorrhoids, and as I said, it is too much common. I hope that we can know more about this problem and the patient could be oriented about the causes to try to avoid this problem and avoid the complications that could occur later on. Thank you so much.